Experts Podcast.
So, welcome back, everyone. Welcome to the new episode of Invisible Experts. Today, we are very happy to host our good friend Gladys again, right? She always
Yes,
are in
yes,
touch
yes,
with us.
again.
Thank you so much, Gladys, to join us in on this new project, right?
Yes.
Because before I invited you to do talks and visit our lectures and be a guest lecturer to people learn from you. And my
Yeah.
first question is, how are you and how you been up to? It's been so long.
Yeah, I'm fine. Like I'm extremely excited to be part of this new project and I'm grateful you always come back to me. So this morning, it's 11 a.m. in Ghana, so it's quite morning. We're getting ready for lunch. I am excited. I am happy. I can't express how I feel to be part of this new project. So thank you for welcoming me on this project.
Fantastic. So how you been up to? I know you've been super busy. We haven't actually met in person for a long time since this
Yeah.
fantastic conference in Ethiopia, right?
Ethiopia.
Yeah,
Yeah, yeah, yeah.
pre-COVID. So how you been?
Yeah.
New projects or
Yeah, so after Ethiopia, I had to restructure my project and take into consideration COVID. So we have to now go more digital. So I've been coming up with these different ideas just to make sure my Ghanaians are well sorted out.
fantastic, Gladys. So let's start talking about your journey, right?
Okay,
Because I know
okay.
you've been through multiple initiatives, like
Yes,
which
yes.
includes Miss Health Ghana, the Roxon Foundation, and so on. So let's talk about how everything started and how come you get so inspired to create this social value.
Okay, so personally, I've always wanted to change the lives of people, and at a very young age, I didn't really have enough money, or I didn't know I could change the world. I knew I couldn't change the world, but I could just change the world from the little corner I find myself. So it started when I was in school, in the university. I would go, I'm a health personnel, so I work in a hospital. I'm a physician assistant. So I'll just gather my classmates, few health personnel. So I'll get physician assistants, I'll get nurses for my school, I'll get lab technicians for my school. Then together we just go and have a health screening in the community. So maybe you can go to a rural area in Ghana. We just do a community project screening, medication that we move. We go to the prisons. So I've been doing these things, and I realized that okay, I have passion in health and healthcare delivery to the vulnerable people in our society. So I started with my NGO, the Rocksons Foundation, which primary goal is to promote health and well-being as well as education. Education in the sense that a lot of Ghanaians in rural area don't really have a lot of role models. They don't see that aside living your community, there is a world outside. There is limited unlimited possibility. You can be whatever you want to achieve. They didn't know that. All that most of the women knew was go to the kitchen, cook, get pregnant, give birth. That was the tradition over there. So we like to go to communities to talk about different career paths, skills acquisition. So you can get people learning how to even do makeup. It's a good job now. So now most of my people who went through my education can now have a job in makeup artistry, have a job in beading, and most of them are in schools because we put them in school, make sure that they go through school, they graduate and have a certificate at least. So that's one of the these are the two main things my NGO focuses on. Then Miss Health Ghana. So Miss Health Ghana is literally a public health initiative project, and the whole idea is to one, bring all health workers together. Because in Ghana, you can go to a setting where in a hospital, even in a hospital, the doctor thinks he's more important than the nurse. The nurse thinks she is more important than a cleaner. But you know what? All these people have to come together to save lives. But when there's a division like that, it's literally kills people, reduce efficiency in the hospital, and that wasn't what I was hoping the future could be. So the whole idea for myself was to bring different women in all walks of life together, but sorry, to bring women in health together, nurses, doctors, lab technicians. come under one umbrella. We empower you. We make you understand that there's there's more to achieve when we work together. Stop the division, create a workable environment, save more lives because that is our priority. So we are supposed to make self-primary goals to empower health workers. So all the ladies in our in our pageants are well empowered. They are celebrated. We literally worship them because their profession is something that we don't joke with. Aside empowering them, the next step is to educate Ghanaians. Now that they know their job, they know that okay, I'm a doctor and I'm proud of what I'm doing. My aim is to save lives. Now they have to educate Ghanaians. Preventive health. You don't have to wait till you're sick before you go to the hospital. Rather, you prevent the diseases before it gets there. So all my pageant queens are supposed to empower Ghanaians to live a healthy lifestyle. Then the last one is to create a world free of diseases. I want the next 4 years or 5 years, we don't have to die because of malaria. We don't have to die because of medical negligence. So a world free from diseases. So these are the three main goals my organization seeks to achieve.
So basically, the Roxen Foundation also fund Miss Health Ghana, or
Exactly,
also they are
exactly,
interconnected. That
exactly,
that's
exactly.
cool.
So most of the projects the foundation does is the same thing Miss Health does. Because when we get a health ambassador, all her projects are being funded by the Rocksons Foundation.
Okay, fantastic, fantastic. Okay, I want to ask you about something which is really interesting. It is you always
Okay.
talk about coming together. Okay,
Yes,
so how
yes.
much influence is from this
Mm-hmm.
Ghanaian culture, local
Yes,
culture of
yes.
togetherness
Okay,
shaped such organization as the Rockinson Foundation from your perspective?
okay. Can you repeat the question again?
Yeah, of course, of course. What I'm saying is like, okay, I have the impression the Ghanaians are very, work together, a lot of
Mm-hmm.
solidarity. So it's
Yes,
kind of a cultural thing, right?
yes, yes,
Because you
yes.
are like, I don't know, always dancing together, like working
Yes.
together, which is a cultural expression, which is
Mm-hmm.
very far from this kind of individualistic perspective
Yeah.
on society, let's say, okay?
Yes.
So, based on this cultural aspect, I suppose it influences projects
Yes.
and initiative as the one that you just mentioned. So, how
Yes.
important for you guys is to bring such togetherness culture into the
Mm-hmm.
organization?
Okay. Okay. So, it's so true that when it comes to Ghana, Ghanaians are so welcoming. They are united. They do things together. But that is when they believe in one thing. When they
Okay,
believe in a goal, they work towards it. But this is our environment where the doctor doesn't believe that the other nurse knows what she's doing. So it's up to we, the organizations, to make them know that the goal is one. Until that time, they don't believe in that, so they don't work together. So the whole idea is to bring it together, and it's so beautiful when you bring all these girls together, and then they're literally in a community saving lives. It's so beautiful. They make it look attractive. They make it look like it's so passionate. And it's so beautiful seeing women actively supporting each other. That is the whole goal. So I love to see my women work together, and it brings a lot of joy. It makes other people know that it is workable. It makes other people want to also learn to do more. And then at the end of the day, a lot of people come together to promote this cause and other impactful causes.
fantastic. So, I want to ask you from your perspective, okay, how would you describe a Ghanaian woman?
Hmm.
How would you do it though? Because you are such empower. I mean, we were fortunate to meet you before. I've seen you talking about your project, and you're very empowered. So I was wondering, how would you describe, because you work with women, also
Yes.
professional women, who are in a
Yes.
very important, sector as the health sector, which is very important in any society.
Yes. Yes.
So from your perspective, how would you
Yes.
describe a Ghanaian woman?
Okay, so before I describe a Ghanaian woman, I've been privileged to visit other African countries.
Okay.
Before, I wasn't appreciating Ghanaian women at all. Because I'm like, oh, but you should be able to do this. You should know this, da 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 da. Until I visited other African countries and I realized that Ghanaian women are different. I don't know if it's because we have different tribes and from the whole colonialism, our culture, women have been empowered. We have people like Yasantua. If you've heard the story about the tale or the story about Yasantua, Yasantua is known to be a warrior. She is literally the first woman who stood up to fight the British when the
Wow.
men were sitting behind, she asked and so was like, nah, if you men would sit for the British to colonize our people, to take our chiefs, I asked and so will fight. So firstly, Ghanaian women are powerful, they are strong, they are go-getters. When they put their mind to do something, they will do it. When they decide to love a man, they love a man with all their heart. When they decide to serve, they serve with all their heart. They are humble, but they have to know their worth. And so it's just like this. There's this is the Ghanaian woman, but there's a blockage. When you remove it and they know who they are, then they give you everything. But when there's a blockage, they don't see it. So when visited most of the African countries, I realized most women don't even have we don't have a lot of entrepreneurs in most African countries. They didn't even know that they can start something. If when we even went to Ethiopia, I realized that most of them are not really empowered like that. Like you don't see a lot of women-led organizations. When I went to um how do you call it, Congo, most of them were not empowered. Like it's just the men. But when it comes to Ghana, almost every woman starts something. Almost every woman wants to be independent. Almost every woman knows what she is about, and that is the whole goal. And I'm so proud to be a Ghanaian.
Wow, that's very interesting. So would you say like the Ghanaian culture is a bit matriarchal?
Very. Oh, not necessarily. Not
Okay,
necessarily
okay, okay,
because of the Muslim tradition. Muslims would never
okay,
allow. Exactly. So it's a balance. It's where you find yourself. But Ghanaians will not just frown on a woman. We've never had a female presidential candidate, but I have vice presidents and people
okay,
support them. So it's a two. Yeah, it's a two. Yeah, my country is very balanced.
okay, okay. That's interesting. So let's talk about health, okay? Because this
Yes,
is
yes,
basically your area of expertise. So
yes.
how is health in general in Ghana? I mean, what are the challenges, et cetera, et cetera?
Okay. So, healthcare in Ghana, I will not say it is 100%. I would not say it is even 80% because our politicians would rather fly out of Ghana for healthcare. So if it was 100%, they would stay for treatment. So healthcare in Ghana is something that we can really work on. It's something that we need to invest in because it starts from the mindset, which I am trying to break the barrier. When the mindset of the health personnel or health workers is good, we don't even care about the facility. They can save more lives. When we work on the healthcare, professionals, then we can talk about the facility. Because if you have the best facility in Ghana and the mindset of the health worker isn't the best, it will still not work. So we work on the mindset of the people, then the facilities. If we don't have the best of facilities in Ghana, but we try what we are doing, and I would actually invite other stakeholders or investors to like come and invest in healthcare in Ghana because we have a lot of loopholes. Now we have a lot of introducing Chinese medicine. We have a lot of Indians introducing Indian medicine. So if you have people out there who would want to introduce different healthcare facilities in Ghana, I think it's a great opportunity to invest in it because there are loopholes here.
Okay, that's interesting. Okay, let's go back to you, no, as a
Hmm.
female entrepreneur. So your work span across health, advocacy, philanthropy, and community development.
Yes.
So, from your experience, how have these diverse areas shaped your approach to making a social impact?
This is a tough one. I think because of the seat I sit in right now, I don't pay attention to a lot of things. When I see something, I see the impact in it. I don't even see the money or I don't see the other things. And then my mates, my team members are like, nah, 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 nah. We should always look at the money because how do we finance? It's like it's always like that. But it's very challenging because I always want to. save more lives. I want the impact to be rich. I want people to I want people to enjoy life because you only live once. So my whole perspective is let's save more lives. It's not always about money. It's not about there's so much joy in completing a project. Anytime I complete a project, I am more fulfilled. Even if I run at a loss, I don't mind, but the impact is always my priority. I'm always excited to see that whatever we did fell on a good ground and to definitely grow.
Okay, okay, that's interesting. Fantastic. I have the understanding, if I'm not mistaken, so you can correct me though, that the
Okay.
Roxen Foundation is a legacy of your grandfather, right?
Oh no, not my grandfather, but yes, it's something I did for my father because my father died and he is Roxton. So it's something
Okay,
in honor of my father. Actually, when my father died, I blamed myself because I should have known better. He was sick. He had a kidney problem, and I would always he had edema of the feet. So when we say edema is when your feet is swollen and then like it's big. So when you press it, there's a hole in it and then it refills again. So capillary refill. So my father was sick and I didn't know. For me, it was like, oh, daddy, you look big, you are okay, you look handsome. But these were all symptoms of kidney failure and I didn't know. So I'll just go and play with him. And then I feel if I had known better, that time my siblings were not at home. My brothers were not home, they were in school, but they were in boarding school. And then my sister was also in boarding school. So I was actually the only child with my family. And I didn't know this. And my mommy too is an illiterate. My mommy, African women are very submissive to to their husbands. So if my father should say that, oh, I'm not going to the hospital, I'm okay, my mommy will listen because that's what the husband is saying. So as the daughter, as an educated girl, I was the one to say that, okay, daddy, this is sickness. Let's pay attention to it. But we didn't. We didn't.
okay.
And my daddy passed away sadly. So I pledge upon myself that I'm going to create more awareness, preventative medicine, advocacy, so that other innocent people don't die. Just a key word like take care of your liver, detox, drink water can save someone's life. Just telling somebody, wake out and wake out can save somebody's life. Telling somebody, don't abuse drugs, don't abuse paracetamol, don't abuse analgesic can save other people's lives. So that is the whole idea. So Roxanne's foundation is in honor of my dad to just preventable death.
That's actually very interesting, Gladys, and thank you for sharing, such an inspiring, story. I mean, of course, it's sad, but eventually kick you off to be the person that you
Yes,
actually are, right?
yes,
But about prevention, it's so
yes.
important, right? Because
Very
health
important.
is not about only how we treat patients, but
No,
also how we prevent such avoidable health, like issues, right?
exactly,
Through food,
exactly,
through
exactly,
exercise, through sports,
exactly,
and so on.
exactly.
So,
Even sun, normal sunlight, it's
okay,
medicine.
a little bit more or less, sorry.
So the sunlight, so from morning, vitamin D, it is the best medicine in the world. Like vitamin D from the sun, inhaling good air, eating well, that is all we need. These are the best doctors the universe can ever give us. And we don't pay attention to them. Wake up, we sit in our cars, go to the office, we don't even get direct sunlight.
So basically, how big is Accra? Is it a massive city?
It's a big city. Accra is big. Yeah.
So people cycling or they just take cars to move from one place to another?
So Accra is such that the rich people, okay, so Ghana is such that the rich people like to show off their wealth through their lifestyle. So
Okay.
even if if the office is like 1 minute walking distance, a typical Ghanaian would drive because they want people to know that they have a car. But the
Okay.
poor one will walk because they don't have an option.
Oh, I
So
see.
you don't get a lot of people in Ghana walking. Like when you go to UK is all about walking because train is expensive, Uber is expensive, so you have to walk. You don't even have a place to park. But in Ghana, we are all driving. We are all driving. You don't even see somebody walking because they're like, nah, they don't want to sweat. They don't want to do that. Da, da, da. So it's just the poor that would walk, not even walk for distance because they can join the bus and continue. So people don't walk, people don't even cycle. They'll just cycle for fun or cycle on weekends because that's what they want to do, but not on a regular basis. No.
So that means there is an opportunity for the Ghanaians to improve their habits,
Yes.
right? The
Yes.
lifestyle,
Yes. Yes.
exercise. How about health in terms of food? Like Ghanaian is a bit spicy, the food, right?
Mm-hmm. So funny enough, our native Ghanaian food is extremely healthy.
Wow. Okay.
We have we have eto. Eto is made with, okay, so we have like bananas, but that one is the longer banana. That one is a ripe banana. We mash it, we add some peanut butter, we add some vegetables and all. That's food. There's no oil, there's nothing, like it's pure organic. We have food like banku and tilapia. We have all our food are very, very natural and good. But now we've adopted foreign culture, and then now we want to eat burger. We want to eat um
Pizza, you
um
know.
yeah, like eat things that are not really our thing, and then it's caused a lot of problem. Like high cholesterol is something that is killing lots of Ghanaians because we
Wow.
have neglected our traditional food. In potompoto, yam, fufu. Most of us are not eating it. Like we're not eating the typical Ghanaian food. Like, everybody's eating, oh, I want to eat some salad. And the salad, Ghanaian salad, is not the healthiest salad because they put a lot of mayonnaise in it. And then the
Of
mayo is
course.
not and then it's rich. Like they put a lot of, to them, the richness of the food, it shows your wealth, like how rich you are. So the normal salad, traditional salad, they'll put a lot of mayonnaise in it, they'll put egg in it, they'll put sardine in it, they'll put tuna in it, they'll put, just not healthy, and they'll eat it at night and sleep. They'll eat at 9 p.m. and sleep, saying that, oh, salad is healthy. So eat that and sleep at 9 p.m. without allowing it to even digest. So our eating habits in Ghana isn't the best. We are trying to create more awareness on eating or having a positive lifestyle.
That's fantastic. So this is one of the actual objective of the Roxen Foundation, right?
Exactly,
To
exactly.
encourage Ghanaians to eat healthy and have, perhaps better
Yeah.
health habits. That's
Yeah,
amazing.
options.
Yeah, like in Roxen Foundation, do you also work with children, right? Unprivileged children?
Yeah, yeah, we do. We
Okay.
do. So
Could you,
education.
yeah, could you
Education, for
share?
instance,
Yeah, yeah,
we
please,
go
please.
to less deprived areas. We go to less deprived areas. We share educational materials to them, and sometimes we even take them to school. Cause in Ghana we have free education, but most of these girls, because they know that there's nothing that they can get from education, they won't go to school. They don't have role models. They don't know that when you go to school, from primary school, you have to go to senior high school. Then from there, you can get a good job. They don't know that because they don't see people come back to the community who have been to school. So they are all not in school. So we actually pay attention to education because we believe that the more we educate people, at least if you educate, let's say, 10 people to go back to school, we can get 3 or 4 people going to the medical field or healthcare field, and that is our priority. Getting more healthcare people to like to share our vision with. So our primary course is education. SE number 4, education. We love education, and also we provide a lot of health services for kids. So currently, we have adopted a polyclinic. So a polyclinic is more like, so we have these big clinics, we have sub clinics, but the polyclinic is more like the least ranks of clinics. So it's for rural areas or less deprived areas. So we have adopted a clinic and we are renovating. We have adopted the children's ward because the state of the ward was terrible. So we adopted a children's ward. We are renovating it to meet a decent standard for other kids to be treated well. So that's what you're currently working on as Miss Health Ghana and the Roxons Foundation.
That's very inspiring. Do you have any, perhaps, moment or example of something that you've done with the Roxen Foundation that moved you as a person or inspire you to keep doing with your work?
I would say everything that I do. Sometimes it's not inspiring until I sit back and I'm like, so all these people are benefiting from just one good act that we did. So something like day, I went with my team to go and buy paint for the facility that we are trying to renovate, the hospital we are trying to renovate. And when we went to the hospital, the nurses, the medical director, they were just surprised. They were happy. They were just saying how much this act of service means so much to them because the state of the hospital isn't the best. So even they themselves, they are not excited to even give out the best healthcare to the kids. Sometimes they can be on the bed and then there's cockroaches and bed bugs biting them. How can they come to the hospital to work if bed bugs are biting them? So these acts of services mean so much to them, and then I get fulfilled out of it. Almost everything we do means so much to me. Imagine we went to just 2 days ago. We went to Legacy Girls Senior High, Legacy Girls College. It's a school for senior high school, like a senior high school for girls. And then as we're talking to them about breast cancer, all the girls there, about 500 population to 600 population, they have never been screened of breast cancer before.
Wow.
They have never done a breast cancer screening. So I literally had to take them through the breast cancer screening. After the event, most of the girls came to me and they said that they are in a home such that they cannot even talk to their parents. They cannot even express how they feel because the parents are not welcoming. So and then most of them were sick and they couldn't even share with their parents because some of them have menstrual problem and they are even scared to tell their parents. So I feel the impact myself is doing in the Rocksons Foundation we are doing is not just physical. Sometimes it's emotional. It's everything together. The girls were telling me about how they are not able to share their diseases with them. So now I took all of them. So they're not able to share their problems with their parents. So I took their contact details and I'll call their parents. I'll tell their parents, okay, so this is your daughter. She has this issue. Would you mind if my hospital take care of her? Da da da. And some of the parents are actually they didn't know that that was the problem they have with their kids. Most parents think that they are just working to get the money to take care of their kids, but they don't know that they need to play a physical and psychological role in their daughter's life. So sometimes
Mm.
it goes beyond healthcare. It's sometimes emotional as well. So these are the things that motivates me all the time.
Wow. So do you think in terms of health, women in Ghana tend to be more vulnerable in a
Of
in a
course,
way? Yeah.
of course, yes.
Uh,
At work,
how, in general, right? In terms of
yes.
like, and I was trying to understand because, of course, I mean, it's hard to maybe understand the culture that you are not very familiar with. How come this is like lack of communication in between
Mhm,
children
mhm,
and parents? Why is that happen?
mhm.
What do you think?
So I think it's how our upbringing. A lot of women or mothers they don't get love from childhood. So it's a trauma from the parent that they pass to their kids. They are not, they are not, their parents don't, let's say I'm a mother, my mommy doesn't treat me well, or growing up, she never treated me well. She didn't give me the love I needed. She didn't show me love. So for my trauma, I'll pass it to my daughter. I'll not give my daughter to that same love.
Yep.
I'll not give my daughter to that same love. So sometimes it's something that is very, it's a tradition. So now you're trying to expose a lot of people that, in as much as you didn't get that love, give it. Pay attention to your kids. Let them know how much they mean to you, and then it will get better. So
Okay.
yes, girls are
Okay.
very vulnerable, very very vulnerable.
So this is the thing because from the people that I've met, right? I mean, few
Mhm.
Ghanaians, I was having the impression that you show emotions easily, right?
Yes, yes,
But
yes.
but based on what you told me, like maybe emotions are expressed through different maybe like things such as dancing or talking and so on. So do you think this emotional like how to put it? Yeah, like because people don't express themselves easily, maybe they can cause some health issues.
Okay, that is so true because a lot of people in Ghana are actually depressed and they don't even know it. They can't
Wow.
talk
Okay.
about depression. Yes, a lot of people don't even know it. So sometimes people can express anger in a different way. And then, so let's say party A, I would express my anger in a different way, but party two doesn't even know that the way I am expressing the anger is because I am depressed. So they also retaliate. Instead of giving me love in return, they also retaliate with anger. So two negative people, it is not healthy. So it's about time that a lot of people learn to know themselves, know their bodies, understand their emotions, and know how to relate to other people. A lot of Ghanaians even need to pay attention to how people react when they're in a different state. Some people can actually be in a relationship and then their boyfriends are depressed, but because he's not talking about it, they don't read the signs that okay, he has low libido, so he's depressed. She rather say that, oh, this guy, he doesn't have a good libido. I'm gonna leave him because he's not performing well. But he needs help, but he's not able to voice out. He doesn't want to be vulnerable. So these are the
Wow.
things that, yeah, these are the challenges that people go through. We have a lot of people walking depressed in Ghana, a lot of them, and they don't know. So most of them end up committing suicide.
Wow. That's very sad, isn't it? But also, like,
Yeah.
this is very interesting because what you try to do with like such organization, such Roxen Foundation, it's in a way promoting love, right? Love
Yes.
to themselves through
Yes.
care, right? Because if you
Yes.
care about yourself, you eat well, you have better
Yes.
habits, as well
Yes.
as connecting people with others and try
Yeah.
to break such a status pyramid, no? As you put it
Yes.
before. You know, this difference in between a doctor and a nurse and a cleaner, everyone providing such a service, which is basically health, right?
Yeah.
So, do
Yeah.
you think this is the way to provide the love that perhaps you missed when you were growing up? And that's why you want to provide love to all these children and people through health? Do you think this is your expression through this kind of journey to try to, provide the love that maybe, or you have the feeling that you missed?
Okay, so I think growing up personally, I didn't get enough love. That is one, but I had a whole community there for me. So my brothers were literally my bodyguards. They will beat everybody that comes closer to me. So I had that kind of love from from brothers. I had a sister love. I didn't just have a mother love because she was going through her own, like she had her own issues. So yes, I could say that because of the love I didn't get, I'm also giving back that love. Yes, that is one of the main things I am actually doing. But let's just say naturally, I love to just help because my siblings are not like me. They also didn't get the same love they also got the same effects that I had. So they should have also done something like that. But my siblings are not like me. It's just me, and my family, who is just on this course, and then they are just supporting me because I'm family, so they have to support me. I love to give love because one, I'm a Christian. And if Jesus Christ showed the greatest love, who am I not to show the greatest love? Who am I not to love people? Who am I not to give back to society? Who am I not to help humanity? Sometimes I feel that is my calling. That is what I'm supposed to do on this earth before my time is up. Show people love and to give back to the society.
Okay, that's beautiful. Thank you for this. No, it's true. It's true. I love your honesty, though. It's not easy to talk about this. So this is gonna lead to my next question. Okay.
Okay.
So first, I want to ask you, how do you deal with challenges? Like, because of course, any organization go through a lot of challenges. It could be financially, it could be operationally. So, if you please answer me this through, first of all, from the organizational perspective. How do you guys, as an organization, deal with challenges? And on the other hand, you, as a leader, how do you deal with this internally, right? Because
Yeah.
sometimes
Yeah.
it's hard to deal with
Yeah.
this
Yeah.
from the
Yeah.
inner circles. How do you do
Yeah.
that?
Yeah. Yeah. I get depressed every day. Like every time I get depressed. Because it's challenging. And the fact that the annoying part is that you have to give people hope. That's hope that you do not have, but you have to still give people the hope because you cannot have all of you depressed at the same time. So sometimes you have to carry the burden, all the burden. Let me share a story that just happened. So we launched Miss Self Ghana just last month, and then we have elections next month. So 7th of no this is we're in okay, so next 2 months, so 7th of December is election. And all companies are trying to hold on to sponsorship because they don't know what will happen after election. So no sponsorship. We just did audition. So we launched Myself. We did audition. We have our beautiful, intelligent girls. And my team members are like, Miss Roxon, I think it's about time we cancelled Myself because we don't have money in our coffers. We don't have anything in our coffers because no one is giving us money or sponsorship. I had to take a bold step to tell them that we do not have it, but we will make it happen. As at now, I don't know how we are making it happen, but I have a strong faith that all things work together for my good. I don't know how it's gonna happen, but it is happening, and it looks good already. My finale will be in next month, 27th of November. We are renovating a hospital. Can you imagine when there's no money, when there's no sponsorship, but the hope and knowing that people will be blessed out of it or people will be empowered out of it keeps me going. I cry almost every after my events. I cry, and it's not just tears of joy. It's because I didn't know how it happened or how it's supposed to be. But at the end of the day, we make it happen. People may not believe in me, but at the end of the day, when we make it, whatever I want to do, when we do it, they all come back to me, actually, how did we do it? And we did it. So I go through, I'm disappointed every day. Wake up and I'll tell God or the universe that take me to it, hold my hand, order my steps. I attract good things in my life. I attract all things I need in my life. And then, like, joke, things that I need would literally come to me. Like you are coming to me and I'm sharing this wonderful experience. And sharing it with you is therapeutic to me because I'm like, okay, wow, I did this and that. So now I'm just thinking about the things I have done and then the impact I have gone to, like, since I started. And it means so much to me. So thank you so much for putting me on. And these are the things that we need, words of encouragement from people, because you and I know that it's not easy. Like, it has never been easy. So we always keep pushing. We always have to empower our followers because they don't have to lose hope. Hope make everything beautiful at the end of the day.
That's true. Thank you for this. Like I always say, like make money is really hard, but try to make money to create social value is even
Yes.
harder because
Yes.
at the end of the day, right, we're trying to make the world better, as you said before, from our corner. Like change the world is hard, but imagine like bringing different people to the same team in order
Yeah.
to create good, right?
Yeah.
So as an organization, how do you guys, maybe deal with challenges? Like, do you have a board of advisors or how do you do it?
Yeah. So I have a board of directors. I have five powerful board directors. I have a lawyer in the board. I have a doctor. I have an entrepreneur in it. I have five board members who literally advise and then handle most of our issues. So even with this year, they actually said that actually, no, we don't. If you guys don't have money, let's not do it. But with me, it's knowing that people have come out that they want to be part of this year's Miss Hill. So we cannot just tell them that no, it is not their fault. So yeah, we have a board that solve problems that we go through it. So we handle issues amicably. And most of my team members are very welcoming and they're very respectful. So no one actually fights, or we have rules that govern everything that we do. It's well structured.
Thank you. Thank you. I want to talk about determination, right? Because of
Mm,
course I can tell you are a very determined person, right? Do you think
yeah.
this is one of the key to be successful in our type of field, but in anything really?
Okay, so it can be determined for a wrong cause, or it can be determined. You can have determination, but it could not make sense. I think the goal should be the priority. If the goal is right and you are determined, it's good. But some people can be okay. I'm determined. I'm a determined person. I'm not going to leave. I'm sorry. So let's say you are married and your partner is not treating you well. Your partner is sorry, is not a good person. And you're like, okay, I'm determined, I'm going to be in the marriage. And the man beats you up or kills you. That is for a wrong cause. So you have to always find the reason or the cause that you feel, okay, this is the right cause that I want to do. I'm determined to make it work. And it will always work. So that's what I always
Okay,
tell people, find a good cause that you're fighting for.
amazing. So what do you think is the values of the Roxen Foundation? What do you think they are the values?
So I would say the value could be respecting humanity. Humanity is the underground, like humanity. Forgetting the color, forgetting the race, forgetting everything. In Ghana, a lot of people are very tribalistic. A lot of people think they are better than other people. So let's say those in the north, no, those in the south think they are better than those in the north. Those who are in the south, like those things. So humanity is the goal, and so humanity being the goal, perseverance and determination. That is our core value. That is our very core value.
Amazing. So do you think that or these are also your core values, right?
My personal, yes.
Yeah. I mean, at the end of the day, right? I mean, the foundation is kind of the projection of yourself, right?
Yes, yes,
Okay.
exactly.
That, that's cool. Listen, I want to talk about failure, right?
Hmm. Hmm.
Because we before we were talking about, sometimes we don't talk about our emotions. We don't want to look and project ourselves as vulnerables, right?
Hmm.
In
Hmm.
terms of organizations, failure is something that is also a taboo, if you wish. People
Yeah,
don't
yeah,
talk
yeah.
about failure, they only talk about, oh, we are so successful or we overcome these challenges, and etc. etc. So, from your perspective, how do you define failure in your organization?
Okay, so with us, failure is not failure. Failure is a stepping stone.
Okay.
So failure is not a shame at all. We like to talk. This I spoke about some of the things that we did, our challenges. Yeah, we failure is not bad. It is good to fail, but the good thing is, what do you learn out of it? How do you come back? We speak about our failure, we speak about our challenges, but it's how we come out at the end of the day. If you fail and you stay failed, that is embarrassing. But when you fail, you rectify all the mistakes and you come back. Oh, that's the powerful comeback. Everybody will be proud of you. So failure is not bad. Failure is a good thing. It's just a time for you to take a deep breath and restructure your whatever you are doing.
Yeah, that's interesting because the other day, I've heard this famous music artist, Ed Sheeran, right? He was
Oh
saying,
yeah.
like, he was suggesting that you don't learn anything from success. You learn everything from
From
failure, right?
failure. Exactly.
And I like how you put it because, okay, failure is an opportunity to learn what we could do better, right?
Yeah. Yeah. Yeah.
For instance, uh, engagement, right?
Okay.
You mentioned before the importance of partnerships and partnering with certain sectors. So how
Yeah.
important is for the Roxen Foundation to make these kind of strategic alliances? And how would you advise other people to engage with potential partners?
Okay, so I think in Ghana there's something called there's a term in Ghana that edua baako praye ubumwa ebebu, but so the praye bebebu mwa ubumbu. That means there's strength in unity. So a prior is a broom. Like when you take a stick from a broom or just a normal stick, it's easy to break it. But when you pile a lot of sticks together, you cannot break it. So there's so much unity, there's so much strength in putting a lot of people together. It reduces the burden, it reduces the stress, it reduces even the responsibilities shared. So I would always advise that people partner, because personally I have a hospital partner that anytime we have issues with regards to health, if you have to sponsor someone's medication, you have to sponsor someone's treatment, I have a hospital partner, and they are also glad to know that they change the lives of some innocent people. So yes, you should always work with partners, and even in our SDG goals, it's partnership. The last goal is partnership. So why would you not want to partner with other people? Partnership is the goal.
Okay, so what is the term in the Ghanaian term about unity?
Okay, so it's not really a term, it's an adage. Ubu prior is a broom, so prior ubu bakuma ebebu. Ubu bebura embu. I don't know how to teach you, but a
Wow.
broomstick, if you break it, it's easy to break. But if it's just a bunch together, it doesn't break. No matter how strong you are, you cannot break it.
Okay, that's very nice. That's
Yeah.
very interesting. So this is basically in your language, right?
Yes, my language, yeah.
Okay. I want to ask you about your like scaling and future goals. Okay. You guys have achieved remarkable impact, right? What are your future plans for scaling the foundation's work? I mean, if you want.
Hmm.
And perhaps are there other regions or areas that you'd like to expand to?
Yeah, so personally, I've actually exhausted a lot of like the whole Ghana. I've been to all parts of Ghana with my with regards to my NGO. We are trying to go outside Ghana. That is the goal, to go outside Ghana, go to different countries. So currently, Miss Health is in about 4 African countries. We want to have more of that, so that at least our impact can be broader and wider, saving more lives.
Okay, that's very interesting. In terms of like, health, right? Or health
Hmm.
advocacy, which is gaining more and more attention like all the time.
Yeah.
How do you see the future of health focused philanthropy involving, especially in Ghana and Africa? What do you think?
Yeah, yeah. As I said earlier, I feel there's a lot of loopholes here, and in the future will be bigger because a lot of Ghanaians are really open-minded and exposed. Once lots of people find the loopholes and invite investors or come up with ideas, innovative ideas, healthcare in Ghana will be one of the top notches. Because even our traditional or local medicine is on the international market. You can go to China. It can be compared to like Chinese medication because we also do a lot of natural remedies, African medication. So it's good. It's just that with that, there's no innovation with regards to that. A lot of plants would rather cure. So, like one plant can cure a lot of diseases, but they don't really measure. There's no measurement to it. There's no preservative way of handling all those things. So if people can look into that, there's a future for medicine in Ghana, healthcare in Ghana, because we have the best natural-based products here. We have shea butter, we have neem tree, we have different variety of plants that are very healthy compared to orthodox. So if we have people to come up with innovative ideas, yes, Ghana has a future for healthcare, and I love it that way.
Okay, okay, thank you. I want to talk about inspiration and your personal growth. Are there any
Okay.
books, mentors, or experiences that perhaps have greatly influenced your philosophy on community work and health advocacy?
Yeah. I would say the person that I used to look up to wasn't doesn't really do so much in health. I used to love Oprah a lot. Growing up, I would just watch her shows. I'm like, Mommy, how can this woman just give out a lot of cars? Mommy, how can this woman just do da for people? So yes, growing up, she was my role model. But now I feel okay. I don't need to walk someone's path because we don't the mistakes they make, and they will not tell us the mistakes they make. So now I don't have any role model. I'll just read stories. I'll just read books. The current book I'm reading is The Power of Now, and one of my favorite book is The Secret. I love The Secret so much because it opens your mind to limited possibility, like unlimited possibility. It makes you know that your brain is just it's just powerful, but we don't know it. So one of my favorite books is The Secret and The Power of Now, and that's what I'm reading. So I don't want to walk on someone's footstep because I don't know the new problem she's going through. And then we are too far from them to ask them questions like, okay, hi, Miss Oprah, can you please tell me when you got here, what did you really do? Because I am there and I'm going through that challenge. So how do I go through that? So now I want to make my own mistakes. I want to fall and I want to rise again.
Okay, that's interesting. If you have to give three tips, you know, for individuals who wants to
Hmm.
create social value and they have no idea how to start, or perhaps they have this kind of initial stage of ideation, what would you
Hmm.
suggest, or what would be your piece of advice?
Okay, so So the three will be: one, get to know yourself. It is very important to get to know yourself. When you know yourself, you know what you stand for. What is your passion? What drives you? Because if you don't know yourself and you just start something, it's not easy. It will break you and you go back to square one, meaning you go back to where you started. But when you know yourself, you know what drives, you can find a niche that's within that drive and it will move you. So one is know yourself. Two, when you know yourself, then you find a cause that you believe in. If the whole world doesn't believe in it, once you believe in it, you can make it work. So find a cause you genuinely believe in it. And the last one is just that. People find a cause, people get to know themselves, but they keep procrastinating. Oh, well, I had this idea I wanted to start and I didn't start. And now once you don't start, someone else is doing it. Someone else has that idea, starting it, and then they become like the pioneers in it. They have all the interactive sessions, they have the crowd support them. So once you have the idea, just start. Don't wait for any man. Start the idea. Start whatever you want to do. So three, get to know yourself. Get to know yourself. Have a course and start.
Oh, thank you. So I want to ask you, so what is your driver then? What drives you
What is
every morning
what is my
to, yeah, what is your driver?
okay? So I think because I know myself, whatever I do is my drive. Because one, I know that okay, I'm so passionate about this thing. It drives me. There are days that I don't want to wake up and move out of bed because I'm tired. I'm like, if I don't do it, who else will do it? So my project drives me. My girls, my doctors, my nurses, when I'm empowering, it drives me. Seeing them, it drives me. Seeing the impact you are doing, it drives me. Because I love it. I'm passionate about it. So that alone drives me to do it over and over.
Okay, thank you. And just to wrap up this fantastic conversation is, how do you think our audience could support your work at the Roxen Foundation or Miss Health Ghana, and or maybe get involved in similar efforts to make a difference in their communities?
Sorry, the question, please.
Yes, is it broken a little bit? It's fine. So, what would
Yeah.
you like maybe ask our listeners to support your work or in their own community to support similar projects as yours?
Yeah. Yes. Yes. I think if you are watching us, you should know that there is a world somewhere that they doesn't even know that they have they are entitled to good health care. Most Ghanaians don't even know that it is their duty, it is their right to health, right to, they don't even know it. So there's a world somewhere. It cannot, you don't have to go streaming, but if you have the means, support Africa. Come back to Africa, talk to them, send stuff to them, send medication to them. They need it so much. They need it. If not, as you are home, just find a little space somewhere, create a create a small community that just promotes health wherever they are. Because now lots of people actually dying from depression. Lots of people are dying from cardiac arrest because their heart is not strong, they're not eating well, they don't have a good lifestyle. So have a team, a small team, go for walks together, go for run, eat healthy, and it's going to save more lives.
No, thank you for that. So you listen to these people, love yourself more, and treat your body as a temple. So with this, thank you so
Yes,
much, Gladys, for
exactly.
giving up your time. We really appreciate you, having you in our small corner, as you say. And this is
Yeah.
how we end. Thanks a lot.
Oh, this was so impactful. It was too short.
Shall we make a photo? And then let me take a photo.
Okay.
Perfect. So this is how we end, people. And thank you for listening to us. Cool. Thank you,
Thank you
Gladys.
so
Have a
much for
lovely day.
having me. You
Cool.
too. Bye.
Bye, everybody. Goodbye.